Hello, I am Dr. Karen Lurito, a pediatric cardiologist at Geisinger Health Systems. I take care of pediatric patients up until the ages of 18 years of age. One of my interests, my specialty, is managing children who have high cholesterol, who may have high cholesterol due to other conditions related to lifestyle, but also those who may have high cholesterol as a result of a genetic defect in cholesterol metabolism. If the child has been found to have elevated cholesterol, if the cholesterol level in the child is greater than recommended for that age or greater than is considered normal for that age, then the parents and the child should have consultation with their healthcare provider to determine the next steps. The healthcare provider may refer the family for genetic testing. If a child is found to have high cholesterol levels and then subsequently confirmed to have familial hypercholesterolemia or FH, there are a sequence of steps that need to be followed. It will be prudent or wise for the family to speak intimately with their healthcare provider to understand what those cholesterol levels mean. Secondly, the family may be introduced to a nutritionist to modify their diet to help decrease the foods that are high in cholesterol and fats to help lower the cholesterol to a certain degree. Third, in pediatrics, there are certain levels at which medication may be considered important to start at an earlier rather than a later age. All first-degree families of a person with a genetically determined high cholesterolemia should be considered for genetic testing as well. It has been shown that the longer the body is exposed to such high levels of cholesterol, the worse the damage to the blood vessels and the heart can be. And so earlier treatment is recommended to prevent long-term, lifelong exposure. There have been instances where a child has been to screen first-degree family members, led to diagnosing the parents themselves with high cholesterol. In some instances, these parents would have gone on to have detrimental consequences of their very high cholesterol had they not been identified through the secondary screening or the cascade screening they went through because their child was tested and because their child was diagnosed with FH, and as a result, other family members could also be screened and lives saved.